Aging and Awesome is a production of the Nevada Senior Care Foundation and Consider It Done Productions, and proudly presented by Lend a Hand in Home Care and Transportation, where our caregivers make the difference. NB Legal Docs, they are the trust masters. Infinity Hospice Care, a family of caring. Boomer Naturals, feel your best with Boomer Naturals. And Senior Care Plus, Nevada's wellness partner. Hello and welcome to Aging and Awesome and our continuing coverage of seniors in the coronavirus. I'm Kai Sisson. First and foremost, a very happy Easter weekend to you and your family. We'll check in with Joe and George, see what they're up to, safe at home later in the show, but we begin with the healthcare crisis facing our world, especially affecting the people who this show is made for, our seniors. Here's what's coming up. There are over 450,000 elder Nevadans who are at risk of serious illness, social isolation, food insecurity, and lack of needed medications due to the COVID-19 pandemic. But a quick response by state officials is ensuring elders are taken care of so they can stay at home. We'll show you how. Plus, our community is stepping up in surprising ways to help each other out, and some are turning their sewing machines into life-saving equipment, supplying essentials to the front lines. Erin Breen has that story. Speaking of Breen, she too is in quarantine. It doesn't mean we can't reconvene. But don't get too close. And a special COVID-19 Kai's Cab. We quiz a friend of the show, Marsha Rambo, on her coronavirus knowledge with some reminders on how to stay safe. Aging and Awesome Seniors in the Coronavirus begins right now. As we know, elders are disproportionately affected by COVID-19 in terms of their impact on their health, with estimated mortality rates higher for all Nevadans ages 50 and older. Simply put, elders need to stay home for the foreseeable future. Directly alongside the public health, healthcare, and financial crises of the coronavirus pandemic sits a senior services crisis that has the potential to negatively impact all older Nevadans. But thanks to a collaborative effort with the Aging and Disability Services Division, the University of Nevada, Reno, the Sanford Center for Aging, and Nevada Senior Services in Las Vegas, they have mobilized a rapid response effort known as Nevada COVID-19 Aging Network, or for short, Nevada CAN. Here's how.
Hi, my name is Dina Schmidt, and I am the administrator for Aging and Disability Services for the state of Nevada. A senior can go online and request help, and then that request will go to a team of our staff at Aging and Disability Services. They will triage it and send the referral out to the appropriate action team. Our action teams are focused in 4 areas. So we have the telehealth and access to telemedicine. That group will work with the senior to identify what their medical needs are, if it can be done via telehealth, if they will coordinate with their current telehealth provider. If their provider doesn't have the capacity for telehealth, then the universities have that ability and will take on that service and provide it. The second group we're focused on is really our community connections and social services. So this is a group of volunteers working to make sure seniors have the connections that they need, whether they want to volunteer to help one another or if they want to receive a check-in call, a weekly, daily check-in call, whatever they would like and need, we would be able to accommodate that either through our own volunteer groups or many of the organizations that already exist throughout the state. And then the third area of focus is really on that nutrition and medication. So that group will be focused on making sure that people have the nutrition needs met as well as any prescriptions delivered to them as needed.
Hi, my name is Jennifer Carson, and I'm Director of the Dementia Engagement, Education, and Research Program at the University of Nevada, Reno. So what we envision for Nevada CAN is a website that is accessible to not just all elders across the state of Nevada, but any concerned citizen can log on to Nevada CAN and connect with important information. And there's also a portal where anyone can complete an online application that communicates an elder's essential needs and their interests in receiving additional support. And so this is a really simple online form that an elder or someone who is supporting that elder can complete. And it identifies what their needs are. Those needs, that form then goes to case managers with Aging and Disability Services Division, and they triage those needs to one of 3 different action teams. And so one action team is really about the mobilization of food and medications to the front porches of elders across the state. And that action team is really going to be seeking volunteers to help us build capacity at the county level for the very important work that county senior service agencies are already doing.
Hi, my name is Peter Reed, and I'm the director of the Sanford Center for Aging at the University of Nevada, Reno School of Medicine. There are community-based aging service providers around the state who for decades have worked to ensure that vulnerable, many times low-income elders have the resources that they need to live well in the community. And suddenly, with all elders, all seniors, being asked to stay at home, being highly encouraged, being required to stay home to reduce their risk of exposure to COVID-19, there's the potential for all of Nevada's elders to become socially isolated, to not have the basic needs of everyday life, and to have limited access to medical and health-related resources that they would otherwise be able to travel out to access. So we're launching the Telehealth Action Team to mobilize an integrated response to ensure that while they stay at home and stay safe from exposure to COVID-19, elders are also able to access medical services, social work services, and other healthcare related opportunities to get them what they need to help them to stay well.
We know that there's over 450,000 seniors now that are in isolation, and we want to do everything that we can to make sure that they're able to stay at home safe and sound and get their needs met. So this is our attempt to get information to them, an easy way for them to reach out and ask for help. So there's many people that have never had to ask for help before, and so this is new for them, and so we wanted to make it really simple, an online way to request information or help, and then we will triage that and get it out to our community partners in the network. And so the Aging Network is statewide and very vast, and so we can help coordinate those efforts with those providers.
So volunteers can join Nevada Can by logging onto our website. There's also a portal for volunteers, and we are actively recruiting.
The mobilization of all of the county and local community-based service providers are coming together to rapidly address this aging services crisis that we now find ourselves in. And it did happen very quickly. I would say we put the whole plan together and in place and in action with a launch within 10 days to 2 weeks.
Nevada can and we will, working together, we are going to make it through this pandemic.
Such an amazing collaborative effort. I'm so thankful for what they're doing in a really short amount of time for our seniors. Please do not be afraid to reach out and see how they can help you. Or if you want to volunteer, head to nevada211.org or simply dial 211. Still to come on Aging and Awesome, Seniors in the Coronavirus. Masks are hard to come by these days, but the effort of these incredible people are ensuring senior care providers and hospitals are getting what they need to stay safe. We'll show you how. And what have Joe and George been up to at home? We pay them a virtual visit and a spin in Kai's cab. But first, let's quarantine with Aaron Breen.
Oh, hey, come on in. But don't get too close. You know, with this coronavirus, we all gotta follow the basics. You gotta stay home, you gotta stay safe, you gotta keep your hands clean, and you gotta keep your mind sharp. I'm gonna show you how I'm doing that here at Club Green. Look, I'm a known news junkie from way back, but even I can't listen to the coronavirus updates 24/7. You gotta turn it off. Take a break and change up your media, just a little bit. I mean, you gotta watch Aging and Awesome, and you need to stay informed. But seriously, can't you do that with like one newscast a day? I'm the worst. I listen to the radio all the time, but I've learned now you gotta listen to something else. So maybe a little classical music? Ooh, or Irish music. Or maybe a podcast. Ooh, my podcast, Aaron's Isle. You can find it at www.aaronmeandbreen.com. Stories of Ireland are way better than coronavirus updates. I'm keeping my mind sharp by putting a puzzle together. Clearly, I'm not doing a very good job at it. But every time I walk by the dining room table here, I put in 2 or 3 pieces. I'm also playing chess online. I always lose, but it's really good to practice for when my son Johnny stops by. I'm making a lot of phone calls and checking in on friends, and I'm reading everything I get my hands on. But seriously, this is what I'm down to in my house at this point. Ghosts and cadavers. And who doesn't have these? Seriously, boxes and boxes of photos, right? Okay, maybe some of you actually took pictures and put them in albums. I just put them in boxes. And you know what? This is a really good time to sit and organize them. So you're getting something done. It's productive, right? Oh, and look at all the memories. Oh, look at that. That's one Megan. She's in the nose of a pumpkin. And look, the kids are so little. So it's productive, and you just go through all of those memories. So that's what I'm doing to fill my time while we're in quarantine. I don't know what you're doing, but whatever you do, please stay safe. For Aging and Awesome, I'm Erin Breen.
Life is story. Pages of amazing adventure and narrow escapes. Bold steps taken, races run, chapters on love and hard lessons and new beginnings. Your life, your legacy, our privilege to serve. Morningstar Senior Living.
Aging and Awesome is brought to you by Donald Bernard, Investment Fiduciary and Senior Vice President of Investments. Native Nevadan Donald Bernard has built an outstanding reputation specializing in retirement. For income ideas, give Don a call. No client is too big or too small. Customized coverage for your healthcare needs. Your Insurance Agency, serving Nevada seniors for over 50 years. Your Insurance Agency offers all Medicare plans. You need a plan as unique as you are. Your Insurance Agency has agents across Nevada. Call 775-209-1010.
Chiropractors like Dr. Brenda Hilby have found a solution direct from Mother Nature to help their patients. Introducing Boomer CB5, a botanical blend of powerful terpenes that gets the body back in balance.
I'm very glad that my chiropractor has introduced me to CB5 because it has changed my life.
I recommend Boomer CB5 to my patients, and I recommend it to you.
CB5 comes in gummies, tinctures, roll-ons, and creams. We know you'll love it. Learn more at boomernaturals.com or ask your doctor about CB5.
Trustmasters is a proud sponsor of Aging and Awesome, providing affordable wills, trusts, and estate planning document services. Trustmasters is much different than your typical expensive law firm. They offer flat fee pricing, customized for each family. Having a trust is so important, and the NB Legal Docs team will explain at their no-cost, no-pressure virtual seminar. Book your appointment today. Head to trustmasters.com. Living trusts. Don't leave Earth without one. Welcome back to Aging and Awesome, Seniors in the Coronavirus. As you know, our co-hosts Joe Della Ripa and George Crozet are very active people. Joe likes to go to water fitness and sit and get fit several times a week. Our buddy George is out and about on his mountain bike or out skiing all the time. But for everyone, the coronavirus has halted most of the things we love to do. And we find ourselves at home way more often than we would like. Let's check in with Joe, see what she's up to. Hey, Joe.
Buongiorno. This is Joe Della Ripa, and this is Mia Casa, my house. And this is my beautiful balcony. Although I can't go out and do my activities that I always do, I still have this. I can see the world right in front of me, and I love it. Since I don't have an outside garden, this is my little garden right here. And everybody seems to be very happy. All my plants are doing well. There's a picture that someone thought I would laugh when they showed me that picture. It makes me feel like I'm outdoors, like this is a lake and those are the houses on the lake. And it's just fun, a lot of fun. This is my little family corner that I love. It's a picture of my mom when she was about 27 years old in Italy, and she got married in a black dress. They used to get married in a black dress. This sign was given to me by my dear friend Carrie, who works at the senior center, and she gave me this, and I said, that is me, and I had to put it up. I look at it every day because that's how I feel about dancing. Well, you know, I never get bored because I always find something to do. I love music, I love dancing, and since I can't do my normal exercise, I just put my music on and I just go crazy. I have fun, and I'll show you what I mean. Here we go, this is it. Pochi soldi, una canzone, jukebox, un gettone, la felicità. I want you all to know that even though it's tough right now, we're all going to get through this, and I will see you shortly on Aging and Awesome.
Hope everybody is doing well with all this crazy virus. First of all, I just want to take a moment to thank all the people keeping the grocery stores open and stocked. A shout out to all the truckers for getting supplies to where it needs to be, and a very special shout out to all the medical personnel. You are superheroes. So what are you up to during this quarantine to pass the time? Myself, I'm spending time in my shop creating furnishings. Creating is one of my passions and helps get my mind off what's going on today. You know, it's so important to find something positive to focus on and not be glued to the TV news. As you can see, I have my home gym, which helps me keep active, anything to keep moving and to get the blood flow. Needless to say, we are all watching more TV than normal. Don't tell anybody, but I watched Hallmark movies with my wife all day. Hopefully that earned me some points with her. What's your favorite TV shows? Well, mine is the Las Vegas Rat Rods, which is located in Las Vegas. They're located in a really cool shop and they built some of the most creative cars you've ever imagined. The bottom line is that I could sit around and let all this pandemic depress me, or I can just keep creating pieces like this. This is such a great chance to call friends and just catch up. It will make you feel better, and even more will make them feel better. That being said, I think I'll FaceTime the grandkids.
Hi, Oma and Opa. I miss you.
Oh, that's so darn cute. Miss you too.
Thank you both so much. I miss you. Stay safe, and we'll see you back here on the show. In times of true need, this country knows how to get things done. And in this community, service groups are using ingenuity and all kinds of material to help keep healthcare workers safe. Aaron Breen has their story.
She's a part of the assembly line. She's making history, working for victory. Rosie.
Meet the modern-day version of Rosie the Riveter. This time working feverishly to produce medical masks for the community.
We're Seroptimus International of Truckee Meadows, and one of our members, Angie Ruyak, who is the director of Infinity Hospice, called us and said, we need help.
And that's all it took to start a movement.
A lot of our members, we have 67 members, wanted to sew. And so I sent out a calling all seamstresses, and here we are 6 days later, and we have done nearly 300 masks.
And it's just been a grassroots effort.
This is the kind of project that offers a lot of people a lot of opportunities to help.
Many of them are donating fabric, their own materials, their time.
The masks are to be used over a regular mask to prolong the life of that regulated mask that the hospital uses. We're so excited for this project. We know we're going to just keep going. The material's coming in. The elastic is like gold these days.
Many beautiful masks of different sizes based on the needs of different individuals. People are being very creative. As you heard Penny talk about, that elastic is gold, so the Seroptimus gals, they're using the ties here, and hair goodies are being used. Just the creativity coming from different people.
The need is actually very real. We started off with just getting enough for our staff, our clinical team, and now we are giving one per patient.
So we're looking to hear what the needs are and how we're going to meet them, and the logistics of how many, who needs them, what size, and so forth. Because you can even see we're looking at children who may be in need. So we're here to help in any way we can.
And there's so much more to this than the sewing.
First, they have to be washed in antibacterial soap by hand and air dried. Once they're dried, then they are packaged based on the needs.
They've established quite a network of creating, packaging, collecting, and distributing these masks. They email the patterns to each other, they text directions, collect them in boxes to keep distance from each other and to keep everyone safe.
That was just the tip of the iceberg. Then that turned into Sierra Nevada Stitchers, and then we've had multiple groups. We have a big group in Del Webb that is making masks for us.
And the veterans in Fernley, too.
We're providing them to Angie's company, who provides to others. That's Infinity Hospice. And then we're providing to Northern Nevada Medical Center, and we're providing for disability resources. And Nevada Hopes just called and got approval from their administration.
We are getting calls every day. They have heard that we are making masks. They do not have enough masks, and they are asking us to please put them on our list to deliver to.
Seroptimus International is no stranger to projects like this. They've been supporting women and girls around the world and in this community for decades now. They know how to get things done. Infinity Hospice knows how to reach those in need.
They need the help. They need this personal protection, and I'm so proud that our Seroptimists are able to do it.
Every sewing machine and every hour of time is appreciated and just may save a life. If you're interested in helping, we'll list all of the contact information for you on the website at agingandawesome.com. I'm Erin Breen.
Closed captioning for Aging and Awesome is brought to you by Infinity Hospice Care, family owned and operated, serving Nevada for over 10 years. They provide dedicated, compassionate, expert care for your loved ones. Visit infinityhospicecare.com today. Still to come, a special spin in Kai's Cab. We have some coronavirus trivia to make sure you are up to speed on how to stay safe while having a little fun, of course. You're watching Aging and Awesome, Seniors and the Coronavirus. We'll be right back. Aging and Awesome is brought to you by Lend a Hand in Home Care and Transportation, family owned and operated, serving Northern Nevada seniors for nearly 30 years. Compassion-driven quality care in the comfort of your home. Call Lend a Hand today, where our caregivers make the difference. Boomer Naturals cares about your well-being and wants to support you in feeling your best. Boomer Naturals doctor-formulated CB5 blend is safe, effective, and legal everywhere. Boomer Naturals is the next generation in wellness products. Head to boomernaturals.com today.
Important health insurance notice. If you're over 65 and recently lost employer-sponsored health insurance, Senior Care Plus is here for you with affordable plans to keep you covered. Call 775-982-3158 or visit seniorcareplus.com today.
Lakeside Manor is the official home of Aging and Awesome. Living at Lakeside Manor means pleasure for the residents and peace of mind for their families. Rooms are available now, starting at only $15.30 a month. Take a tour of Lakeside Manor today. Aging and Awesome is brought to you by Eden Home Health, Northern Nevada's highest-rated home health for quality of patient care. Patients have a choice. Ask your doctor for the best in-home health care. Eden Home Health. Don't let a mobility issue keep you from enjoying the things you love. MedTech Services in Reno has been providing mobility equipment and automotive solutions to Northern Nevadans since 1988. Visit MedTech's showroom inside the Big Yellow Building at 555 Gentry Way. Welcome, welcome, welcome to a Kai's Cab COVID-19 edition. We got our gloves on, and in the back today is one of our favorites of the show, Marcia Rambeau with Transaction Realty 500. Hi, Marcia.
Hi, Kai.
I know, it feels kind of weird doing this, but we are 6 feet apart.
That's right.
I can't
That's
feel
right,
ya.
I got my gloves
We
on.
got our distance on, we got our gloves on.
Yep.
Now we're gonna get our trivia on COVID-19 questions. How do you feel?
Oh, I'm ready. I'm putting my thinking cap on.
Are you ready to play?
Oh, I'm ready. Let's go.
Do you know the rules?
I do know the rules.
Get 3 out of 4 questions right here,
That's
Marcia,
right.
and we have chocolate for you from the wonderful chocolate shop in Gardnerville.
That's right.
Let's play Kai's Cab,
Okay.
COVID-19 edition. It's a true or false question, so you have a 50-50 shot. True or false? My dog can give me COVID-19. True or false?
True.
Marcia, false! Well, apparently, Marcia, there have been at least 2 instances of dogs being infected, but there is no evidence that a dog, cat, or any pet can transmit the coronavirus, which is mainly spread through droplets, right? Droplets produced when an infected person coughs, sneezes, or speaks. That's okay, Marcia. That just means you got to get the next 3 correct.
That's right.
Second question.
Okay.
Who's at highest risk of developing severe COVID-19 disease? You got to choose 2. Here are your options. Children, pregnant women, people over 60, and those with pre-existing conditions. Of those 4, which 2 are most at risk?
People over 60.
And?
The last one.
Those with pre-existing conditions?
Yes.
That is correct,
Yay.
Marcia.
Okay.
That's why on Aging and Awesome, we want to make sure people are aware, informed, and staying safe. Now, of course, people of all ages can be infected by the coronavirus. However, the older people, of course, and those with medical conditions such as high blood pressure, diabetes, asthma, and cancer are at a greater risk. All right, Marcia, you are, let's see here, 1 for 2. You got to get the next 2 right. Your third question, Marcia. What is a fomite? Is it A, a hospital-grade disinfectant, B, a disease carrier, C, a contaminated object or surface, Or D, an immunity-boosting supplement? Marcia, a fomite.
B.
Marcia.
C. It's
C? Is that your final answer?
Is it C?
C.
C. I know I've heard of it.
Yes.
It's C.
Marcia.
Okay.
A contaminated object or surface. Now that can include a doorknob, utensil, things like that can transmit infectious organisms. Now for households with a suspected or confirmed case of infection, the CDC suggests keeping the person separate from others as much as possible and daily cleaning and disinfecting of high-touched surfaces like those doorknobs, countertops, refrigerator doors. Got to do that. It's just important, just keep disinfecting things that are being touched a lot by a lot of different people.
Yes.
The steering wheel, which I did disinfect this here steering wheel.
Okay.
And the seatbelt buckle and the entire vehicle.
Oh, very good.
Of Kai's cap.
Very good. Thank you, Kai.
All right, Marcia. You're now 2 for 3. You got to be 3 for 4. Your fourth and final question, Marcia. They are all important, but which one is more important for preventing infection? Is it A, wearing a face mask, B, frequent hand washing, C, social distancing, or D, taking those immunity boosting supplements? Which one is most important, Marcia?
Is it B?
Frequent hand washing?
Yes.
Correct!
Yay!
Wash those phalanges, folks.
Yay!
Most important. You won.
Yay!
Were you worried?
Yes, I was.
You were a little worried.
I was
know.
very worried.
Why?
And then I get the first one wrong.
That's all right. That's why we do 3 out of 4, and you did a great job too, Marcia, because you helped inform our folks at home on how to stay safe.
We all need to be safe.
But it doesn't mean we can't have a little fun.
That's
Social
right.
distancing fun.
That's right.
Thanks for playing Kai's Cab, Marcia.
Oh, you're welcome, Kai.
Aging and Awesome is brought to you by my friend, Marcia Rambeau, with Transaction Realty 500. With over 30 years experience, Marcia Rambeau is an advocate for seniors. If you're looking to downsize and make a home better fit your lifestyle, call Marcia Rambeau today.
Well, that's all the time we have for today. Thank you so much for watching. Remember to head to our website, agingandawesome.com, to find more information and resources from our seniors and the coronavirus coverage. Just click the link at the top of the homepage. This show would not be possible without the support of community stakeholders who have made a vested interest in bettering the lives of our seniors and their families through Aging and Awesome. And on behalf of Joe, George, Aaron, and the production team, a big thank you to Lend a Hand in-Home Care and Transportation, Infinity Hospice Care, Morningstar Senior Living, Donald Bernard Investment Fiduciary, Senior Care Plus, Eden Home Health, NV Legal Docs, The Trust Masters, Marcia Rambeau with Transaction Realty 500, Your Insurance Agency, Boomer Naturals, and MedTech Mobility Services. We will see you next week, 7 p.m. on CBS in Reno, 7 a.m. on the CW Las Vegas, and an encore showing on Sunday at 11 a.m. on MyLV TV. Thank you for watching Aging and Awesome. I'm Kai Sisson. On behalf of Joe, George, Aaron, and the production team, stay positive, stay healthy, and happy Easter to you. See you next week.
1, 2, 3, listen.